Now, dissociative symptoms are experienced as unbidden intrusions, which are known as positive dissociative symptoms, such as derealization, depersonalization. Depersonalization means that the individual feels unreal about him or herself, and he or she, as an extension of it, also feels the world is unreal, as if you are in a very fantasy state or you are in a dreamlike state. ये इनको पॉजिटिव डिसोसिएटिव सिम्टम्स कहा जाता है. On the contrary, there is also another set of symptoms जिसमें the person shows inability to access information, and these are known as negative dissociative symptoms, such as amnesia, means memory loss. So जहाँ पे loss हो रहा है, that is actually negative symptoms, and where there is addition that the person is unable to, that doesn't happen in reality, जो नॉर्मल लाइफ है, लेकिन अदर देन दैट वो इंडिविजुअल अपने आप को अनरियल महसूस कर रहा है, ड्रीम लाइक स्टेट में फील कर रहा है, और उसको दुनिया भी अनरियल महसूस हो रही है. दोज आर नोन एज अनबिडन इंट्रूजन्स एंड पॉजिटिव सिम्टम्स ऑफ डिसोसिएटिव डिसऑर्डर. Dissociative disorders are frequently found as aftermath of trauma. That's most probably is the reason कि इनको अब anxiety disorder में से निकाल के now they have been considered in DSM-5 in trauma related disorders. So mainly ये देखा गया है कि identity disorder और memory disorder और other dissociative disorders are actually after the trauma. So soon after trauma, they are associated with some traumatic symptoms or traumatic event. Many of the symptoms, including embarrassment or a desire to hide themselves, are influenced by proximity of trauma. कि कुछ symptoms का cluster ऐसा है कि आपको पता चल रहा होता है, let's say somebody met in car accident, somebody has witnessed some trauma, like people being killed in front of them, or somebody has seen terror attack happening in front of him or her, or has survived that. तो ये जो है इनकी proximity mean after subsequent to that the person may lose memory or may have different identity. So actually ये एक तरह का आगे हम जाके reasons में देखेंगे. This is kind of a trying to dissociate that incident or that event from the memory, क्योंकि उसका जो याद आना है या उसकी जो बार बार जहन में आना है वो individual के लिए distressing होता है. There are different types of dissociative disorder. First one is dissociated identity disorder, previously known as multiple personality disorder. So dissociative identity disorder means that the individual may have multiple personalities, और वो personalities जो हैं इसकी डिटेल हमें आगे जाके देखेंगे हम कि वो उसका मतलब क्या है. लेकिन previously it was known as multiple personality disorder, now it is dissociative identity disorder. The second type of dissociative disorder is dissociative amnesia, means that memory, disruption in memory. Then the third type of dissociative disorder is depersonalization and realization disorder. Depersonalization, where the individual him or herself feels to be unreal, वो लग रहा होता है as if he or she is witnessing herself as an alien, and the person feels that he or she is not the real self. Realization means that it's expansion of depersonalization, that in addition to looking him or herself as unreal, उसको दुनिया भी unreal लग रही होती है, दूसरी इर्द गिर्द की चीजें भी unreal लग रही होती हैं. Then there are other specified dissociative disorder, and then there are unspecified dissociative disorder. So इन सारों की detail diagnostic criteria और इसकी symptomatology we will see in a while.